Welcome back to the Dr. Jeffrey Tauth Heart Talk Show, and today's show is called Dr. Jeffrey Tauth Heart Palpitations Red Flags. And trust me, it's juicier than your cousin's peach cobbler. Are those heart flutters keeping you awake at night wondering if you're having a heart attack? You're lying there at 2 a.m., heart doing the cha-cha, Googling, "Am I dying?" on your phone. Well, today we're uncovering when heart palpitations are actually dangerous versus when they're just your heart being a drama queen. I'm going to give you the 3 warning signs that mean you need help now, and spoiler alert, most of you can go back to sleep tonight without worry. Let's start with the truth bomb here. Most palpitations feel scary but are completely harmless. Your heart is like that friend who overreacts to everything, dramatic but usually fine. The normal triggers that make your heart flutter are the usual suspects: too much caffeine, stress, exercise, or when you've been burning the candle at both ends with no sleep. Yep, entirely true. Your heart is basically throwing a tiny tantrum because you've been treating it like a college freshman. But here's where we separate the wheat from the chaff. The red flag symptoms that should make you sit up and pay attention are chest pain, shortness of breath, dizziness, or fainting. If your palpitations are rolling up to the party with these symptoms, that's when you need to worry. It's like the difference between your smoke alarm going off because you burned toast versus your smoke alarm going off because your house is actually on fire. Now, let me drop some medical reality on you. 99% of palpitations are just benign heart rhythm variations. I can't make this stuff up. Your heart beats about 100,000 times per day. That's more action than a Marvel movie marathon. So if a few of those beats decide to get creative and throw in some extra flourishes, that's actually pretty normal. It's like expecting every single word you speak all day to be perfectly enunciated. Unrealistic and frankly unnecessary. Dangerous palpitations usually don't travel alone. They bring friends, and bad friends at that. We're talking chest-crushing pain, can't catch your breath, the room spinning like you're on a carnival ride you never wanted to get on, or lights-out fainting spells. The key here is pattern recognition, not isolated episodes. One weird heartbeat is like one weird text from your ex, probably meaningless. A pattern of weird heartbeats with concerning symptoms? Maybe I should see you in the clinic. We need to talk. Let me tell you about Sarah. She's 34, and she rushed to the emergency room 3 times for heart flutters after her morning coffee. 3 times. The ER staff probably knew her coffee order by the 3rd visit. All her tests came back normal. And you know what we discovered? This woman was drinking 6 cups of coffee daily, plus energy drinks. Her heart wasn't having palpitations, it was having a caffeine-induced rave. So what did we do? We cut her caffeine intake in half and added a magnesium supplement. Within 2 weeks, her palpitations dropped by 80%. Now she knows her triggers and feels confident managing them instead of speed dialing 911 every time her heart does a little skip. Sometimes the solution is simpler than we think. It's not always a medical mystery worthy of a TV drama. Here's your actionable takeaway, and I want you to actually do this. Track your palpitations for 1 week. Note the triggers, the timing, what you were doing, what you ate, how much sleep you got, and any symptoms that tag along for the ride. Become a detective of your own heart rhythm. If your palpitations happen with chest pain, fainting, or severe shortness of breath where you feel like you're breathing through a straw, call 911. Don't mess around with those symptoms. But if you're just dealing with the occasional flutter without the scary friends, try this experiment. Eliminate caffeine completely for 48 hours and see what happens. I know. Asking you to give up coffee is like asking you to give up oxygen, but humor me for 2 days. You might be surprised at what you discover about your heart's relationship with that morning cup of joe. Remember, your heart is incredibly resilient, but it's also trying to communicate with you. Learn its language, respect its signals, and most importantly, don't let fear run the show when knowledge can give you a peace of mind. This has been the Dr. Jeffrey Tauth Heart Talk Show. Until next time, stay healthy, and remember, if you're looking for answers, check out drjeffreytauth.us.com. Later, y'all.